not gonna be having sidebar conversations with my friend in passing. But no shift should be walking into a completely bare, empty room. I'm giving report to you, you're giving report to me. We are locked in right now. Sweetheart, it's not a work, it's your job. Hey guys, it's Britt. Welcome back to my YouTube channel. So in today's video, I'm going to be talking to you all about nurse etiquette. So you might be asking yourself, Brittany, what is nurse etiquette? I'm gonna tell you. Nurse etiquette to me is what every single nurse all over should master in order to create a respectful work environment. Let's go over the definition of what etiquette is. So, what is etiquette? Etiquette, from the Oxford Dictionary definition, is the customary code of polite behavior in society or among members of a particular profession or group. Used in an example, the rules of etiquette are changing. Now, let's flip that definition and make it more centered around nurses. So we could say, the customary code of polite behavior among nurses in the workplace. Nurse etiquette. I have 5 simple rules. Only 5 simple rules, guys, that I feel like every nurse should master. And after this video is done, I want you all to reflect. I want you all to think to yourself, do I have nurse etiquette? If the answer is yes, I want you to think how you can master these skills and improve them even more, and also how you can spread awareness amongst your work environment. So all the nurses in your work environment, all your coworkers have nurse etiquette. Now, if the answer is no and you don't believe that you have nurse etiquette, I want you just to take some time and reflect and think about how you can apply these 5 simple rules every day in the workplace, and think about if you think that these will have a positive impact in your work environment. So guys, without further ado, let's get into the 5 essential rules of nurse etiquette. Rule number 1, stock your room. Guys, this is essential. We do not want our coworkers to fail. We want to set our coworkers up for success. It doesn't matter if you don't like your coworker, if you have beef with your coworker. It does not matter. You need to set them up for success. Always set the next shift up for success. I cannot stress that enough. Me personally, when it hits the 5 o'clock hour of my either AM or PM shift, I begin to go in my room and make a list of all the stuff that the room needs before I go. So, for example, I have my 2 kiddos in the ICU. Let's say room 56. It's 5 o'clock. All right, just did my 5 o'clock vitals and everything like that. Just documented everything I needed to document for the 5 o'clock hour. At this point, before I'm leaving the room, I'm taking a nice little 360 around the room, looking in my drawer, looking where everything in the room is stored and seeing what I need. Oh, so-and-so needs diapers. So-and-so needs their feed formula, more feed bags. They need some gauze in the drawer. Perfect. Then I'm moving on to my next room and doing the same thing. It's not hard. Leave yourself time to do it before the next shift comes in. It's that simple. Now, I'm gonna give some people the benefit of the doubt. Sometimes things go left, right, up, down, completely different directions, and unexpected things happen. So sometimes you don't have time to fully stock your room. If I realize for some reason, there have been maybe like a couple occasions that I just gave a report and I realized like, oh shoot, like I forgot to do my little checklist and grab what I need to grab, I'll at least offer to the next nurse, hey, while you're looking around, is there anything that you see that I don't have in the room that you want me to grab for you? Or I'll be right back while you're checking the room. I'm gonna go grab you this, this, and this. You know, it's just nice and common courtesy to have everything set up for the next nurse and just to set them up for success. And I'm gonna tell you guys specifically why. There have been so many times where I have walked into either my AM or PM shift, and granted, it was probably a busy shift for the previous nurse, but I'm literally getting in my groove, doing my vitals, doing my assessment. I'm ready to pass my meds or do what other cares I have to do for that hour, and then I go in the drawer and there's nothing in there. The time it takes me to leave the room, walk to the supply closet, gather the supplies, walk back. You guys may not think it takes a lot of time, but those few minutes, guys, are super, super precious, especially when you gotta have good time management. Like, it's just trust me, those few minutes are very, very precious. And don't let it be an isolation room, because if you walk in, gown up, get all your PPE on, started your cares and everything, and then you look in your drawer, you look in the closet, and there's nothing in there, let's account for all the time that you have to de-gown, take your gloves off, take your goggles off, put everything, wrap everything up, toss it to the side, go out the room, walk down the hall, gather the supplies, walk back up the hall, then put all your PPE on again, and then go back in the room. Trust me, guys, I know it doesn't seem like a lot, but it's very time consuming, and those moments are precious. Like, guys, if I'm not stressing anything in this video, I'm stressing this. Stock your rooms. It is super annoying. And maybe like I just like let little things like that get under my skin. Like, I don't hold it against the person, but it's just like common courtesy. Like, how would you like to come into a room that doesn't have the kids' meds, no diapers, they just had a blowout on the bed, you have no wipes to change them, and you have to run out the room and get all this stuff? Like, just think about how you would feel in that situation. You'd probably feel really overwhelmed, because not only do you have to do all their cares, pass their meds, but you also have to do your assessment. You have to make sure they're turned, you have to make sure they're repositioned, you have to make sure, I don't know, they're suctioned, you have to do their vitals. It can be very overwhelming. So having the room stocked and ready is just one way to make everyone's life super, super easy starting the shift. Moving on, nurse etiquette rule number 2. Help your neighbor. I feel like this rule is super, super self-explanatory, but I feel like there needs to be a little bit more emphasis on taking the initiative to go up to your neighbors and just in passing say, hey, is there anything I can do for you? Is there anything I can get for you? Now, my job, I will say, the nurses on my floor, very, very helpful. I feel like every shift that I have at my job, there are tons of nurses like in passing or walking by on my side that are just like, hey, like, do you need help with anything? Is there anything that I can do for you? And guys, it just makes my shift so much better, because even though I may not need anything in that moment, it just reminds me that I have someone there to help me. Now, nursing can be very stressful. Your patients can have a lot of cares, you can have a lot of tasks, the doctors are throwing in orders, things are constantly being adjusted, and you will never go through a shift not needing help. If you go through a shift not needing help, then damn, kudos to you. But every shift, I need help with something, even if it's something as small as, hey, can you get me a pulse ox from the supply closet? So this is really self-explanatory, like I said, but just think to yourself, take the initiative a little bit more to have that etiquette and that courtesy and that politeness to just go up to your neighbor and be like, hey, is there anything I can help you with? Because you never know. One, it's going to make that nurse's day to know that they have someone there to help them throughout their day, and you want that support too. You would be surprised like how many people like take that kindness and show it back to you. Like, I've had so many nurses help me out. Like the other day I had a great nurse that I was working with. I remember she helped me when I first started and I was like super lost. So to pay back that kindness from that one time, I started her bath for her. Like, and I'm not saying it's like tit for tat or you have like you're giving to receive, but it's just nice to have that support in the workplace. Guys, please do not be that nurse where you have that attitude that these are my patients, these are the only patients I'm taking care of or that I'm responsible for. No, truthfully, you are responsible for all the patients around you. Like, that's just like, I hate that mindset, because it's like the stupidest mindset to me, because it's like saying, oh, if that patient is literally like going into cardiac arrest, like, oh, I'm just gonna walk by and grab the nurse whose patient it is because they're not my patient. Like, I'm not responsible for them. No, that mindset is so effed up, y'all. And you do not want to be that nurse. Trust me, you do not want that rep with you, because when you need that help, no one is gonna be there to help you. Moving on to nurse etiquette rule number 3. Staying concise and focused during report. Y'all, I love this one because it's like, I feel like people really struggle with this one. Let me tell y'all, let me explain. let's focus on the first part of what I just said. Staying concise during report. Now to me, staying concise during report is saying all the important things. During report, you want to hit the important and significant things about your patient. Now me, I work in pediatrics. We have on our report card a section for each kid, what we call social. So we talk about the child's like social status as far as like who's involved in the child's life, like mom, dad, who's currently at the bedside with them, who should we be expecting to visit, all that stuff, what their family dynamic is like essentially. Me personally, during report, I don't care if mom went to Target and got a purple sweater. That's not relevant to the patient. I don't care. I don't want to hear about that. Leave that kind of stuff out your report. Like it's just not relevant, and it's a waste. What I would care about in that section is for you to say to me, hey Brittany, by the way, Billy's parents are divorced. There's a visitor restriction on dad. He's not allowed to be here in the presence without mom here because she has full custody of him. That is the information I need. I don't need to know about mom and her Target runs and her Starbucks run. I don't need to know any of that. It's not important. I don't care. So really picking the important information and staying concise during report, like, is super important because you just want to get to the point, have the person check the room and get started with their day. You don't want to lollygag and say unnecessary information that's going to make report even longer, especially when you have chronic patients and the report is already going to take long. Like, I just worked a 12-hour shift. I'm ready to go. And I know you're ready to start your 12-hour shift and I don't want to hold you up. Now let's focus on the second part of what I said, staying focused during the report. Super, super important, guys. Really important in nurse etiquette. We're going to stay focused in report. I'm not going to be having sidebar conversations with my friend in passing. Me and you, we're giving report. I'm giving report to you. You're giving report to me. We are locked in right now. We are focused on each other. It's me and you against the world, boo. Nothing else. Yeah, my friend might walk past and say, hey, what's up? I might say, hey, what's up? Yep, giving report now. Talk to you later. Let's keep it at that and keep it pushing. I'm not about to say, hey, oh my God, girl, I just had the longest 12-hour shift. Yes, we gotta do coffee. That, no. See, that's not gonna fly. That's rude. It's disrespectful. Like, I'm pretty sure you're trying to get your day started. Like I said, we're locked in. When you're giving report, it should be you and the other nurse. Not you, the other nurse, and another nurse. We're not doing that. So, guys, stay concise and focus during report. I want to leave my 12-hour shift, and you need to get your day started. And it's important to get in there and get started, assess the patient, make sure there are no changes, make sure the patient's safe and everything like that. Like, we don't have time to be lollygagging around. Okay? Okay. Moving on to nurse etiquette rule number 4, humbling yourself. Now, I'm gonna break this up into 2 parts like I did with rule number 3. Humbling yourself as far as nurse etiquette is concerned is, I feel like in the workplace, there are lots of nurses that, get to higher positions. I would say some of them forget where they started. There's sometimes like condescending attitudes. There's like kind of like the vibe like I'm better than you kind of thing like going on. Like, it's not cool. And guys, just remember where you started. Like, for example, there have been some times in like maybe the workplace where I felt like I've asked a question to a more seasoned nurse and they look at me like I have 5 heads, or like they question me or act like I'm the dumbest person in the world. And it's just super frustrating because it's like, 1, I just want you to answer my question so I can get on with my day. And 2, it's like, you know what? I know you started somewhere like I did, started just where I was maybe not even too long ago. And I know we all have those what we think are dumb questions, but we choose to ask them anyway. And to me, it's like, I know you definitely felt how I'm feeling now, you know, scared to ask a question or like a little bit intimidated. So why is it that you want another person to feel the way you did, knowing that it was such a, for lack of better words, shitty feeling? Like, come on now. With that being said, I'm pretty sure all of you have heard of like nurses eating their young. Like, I'm not sure where this whole eating the young thing came from. Like, I'm not your child. No, definitely not your child. So don't talk to me like I'm your child. And I don't know if a lot of nurses are doing that because that was done to them. But it's like, you know, just take a step back and remember how you felt when it was done to you. And like, why are we continuing the toxic cycle? Why are we continuing this cycle onto new nurses? Wouldn't you think you would want to break the cycle and set a more positive environment for new nurses to grow? But no, because you had that shitty experience, you want to push it off onto other nurses and don't want to break the cycle. Like, what are we doing that for? It's childish, it's stupid, and it just creates a toxic work environment and workplace because it creates friction among coworkers. I feel like it's definitely important to remember where you came from and remember to humble yourself and not make anyone feel how you did. Like, if you felt crappy and felt like you could never come to someone, or you felt like you were being looked down upon, try your best not to push off those feelings on new nurses. Like, we're already nervous, we're already intimidated, you know, just try and put yourself in our shoes and remember what your first few months was like as a new nurse, and think about how you would feel if someone was giving you those same vibes. The second part to humbling yourself is one thing that I've heard, not in the current work environment that I'm in. I will say that I have not heard this in the current work environment that I am. And since I've been working in pediatrics, I heard this working with adults at another hospital that I used to work in as a patient care assistant. When nurses say, I'm not doing that, it's aid work. Come again? It's not a work, it's your job. And you may not feel like doing it, but whether you like it or not, it's your job. I feel like a lot of nurses have this misconception that we can't turn patients, that we can't grab our own vitals, that we can't grab a blood sugar, that we can't change our patients. Yeah, I'm just gonna get a tech to do it. I'm gonna get the assistant to do it, whatever. I don't wanna do it, blah, blah, blah. It's your job. And there's a difference between saying, no, I'm not going to do this because it's not my job, versus I'm going to delegate to one of the techs or the aides right now. Yo, when I used to work as a patient care assistant with adults, that used to grind my gears to no end when the nurses would act like they couldn't help me turn a patient or change a patient or help me bathe a patient. At the end of the day, guys, it's just plain wrong. You have to look at certain stuff in nursing. Like, if it needs to be done, it needs to be done. Like, if you don't feel like doing it, like, tough luck, hun. Like, it needs to be done. If your patient is sitting in a pile of poop, like, they have to be changed. You can't just leave them like that. Now, if your patient is sitting in a pile of poop, like I said, it's completely different from you saying, oh, I'm not doing this, it's not my job, versus you have another important med to give in your other room, but you want to get this patient cleaned up and you say, hey, I'm going to delegate this to the techs. Like, I really have to give this other med right now. It's due, it's already late, it's pressing, like, you know? So yeah, it's okay to delegate, but you're not about to be walking around here like, oh, that's not my job, so you do it. Just remember, humble yourself, and you are not above any form of patient care, whether it is changing the patient, repositioning the patient, helping the patient blow their nose, helping them ambulate, getting them bathed for the day. You're not above none of that. And finally, guys, nurse etiquette rule number 5. Lucky number 5. Do not turn a blind eye. And this rule is very simple as well. If it needs to be fixed, don't look the other way. just fix it. So this rule can pretty much go for anything, but I mean, like, sometimes you have patients that have like lots of lines for their IV, and lines can get very, very tangled, like knotted, like it's a mess, and it's even harder to like unravel like as the days go on. So it's like, imagine that problem could have just been avoided if the first day you got that patient, you noticed that the lines were starting to get a little knotty. You decided to take the time, the extra 5-10 minutes to spend in the room and unravel the lines so they're nice and neat. Now you're on your third day with this patient and you can't even trace your lines. You don't even know what's going where because you let the lines get knotted and decided to say, hey, I'm just gonna leave it for the next nurse, they'll figure it out. Next nurse comes, they didn't figure it out. They're like, oh, well, not my problem anymore. It's time for me to clock out. And now you're back with that patient and it's just a big jumble mess. Like, you know, you could have prevented it, but because you turned a blind eye, now it's a mess. So I'm saying this to say, like, don't turn a blind eye. If it needs to be fixed, fix it. If it's broke, call someone to repair it. If you don't know how to do what needs to be done, call someone for assistance, use your resources, but don't turn a blind eye. And turning a blind eye, you guys, you never know, can lead to like something detrimental. Like, it might seem like something so small, but like, say those lines were super, super tangled and I decided to leave it for days on end, and then the next nurse came in and she accidentally gave the wrong med through one of the lines because she couldn't figure out where it was going. She kind of just guessed, and now the patient is put at risk and or harmed because no one took the time to fix what needed to be fixed. It's that simple. Don't look away. Just fix it. Guys, so those are all the rules that I have for you guys regarding nurse etiquette. I hope you guys enjoyed this video, and I hope you were able to take the time to reflect and ask yourself, do you have nurse etiquette? Yes or no? If it's a no, how can you take some of these tips and apply it in your everyday work environment? I would like to know what you guys think about these tips, if you think that they are beneficial, and if you think by applying these tips, it would just make a more cohesive and respectful work environment for us nurses. So feel free to drop your thoughts and opinions down below in the comments. And if you enjoyed this video, be sure to give it a thumbs up. Leave a comment either way. I want to interact with you guys. And if you guys are enjoying these nurse videos, please thumbs up this video so I know and so I can make more and help all my nurse baes out. Guys, once again, don't forget to like, comment, share, and subscribe to my channel, and I will see you guys in the next video.